will begin. I wanted to thank everybody for showing up to our last webinar of 2021. And I want to thank our great speakers from CGS and Montana State. I'm Alexis Knob. You have probably been to some of my the webinars I've hosted for the Physics and Astronomy Sea Change project. That is a whole bunch of things that I am going to post as soon as the link in the chat then. So you can read more about it, but I wanted to get started with our topic because it's a very serious topic, and also it's a really important one, I think, to consider as we are returning back from, or I guess you all have returned, many of you have returned to the in-person classes and whatnot. So thank you, and we'll get started with our first speakers. Janet Gal and Suzanne Ortega, and I will be sharing the screen, my screen right now with your slides. That should do it. We're good?
We're good.
Cool, so let's begin.
Thanks so much, Alexis. Thanks for the invitation, and colleagues, it's great to be here with you today to talk a little bit about lessons we are learning about the impact of COVID, really this era of racial reckoning as well, on progression into and through graduate study. I want to sort of summarize at a very high level that probably the major takeaway for me of the pandemic has been that the pandemic did less creating of new challenges and opportunities than it did revealing long-standing trends and escalating them. So, for example, we know that over time, pathways into graduate school have been far less linear than they might have been when you and I started graduate school. People start and stop, they delay entry, and that trend appears to have only escalated. Not only are pathways into graduate school different, we know that the pandemic has highlighted the disproportionate burdens of care and financial disruptions that women and communities of color experience, and Janet will be speaking more about that. But it also, that disproportionate caregiving, the uncertainty of the times, has escalated stress and anxiety, and I know Craig is going to have a lot to say about what we've learned about that. Next slide, please, Alexis. So what I'd really like to do is talk about results from baseline surveys that we did in conjunction with colleagues. Next slide. And I simply want to summarize the results of our NSF-funded project investigating challenges to matriculation and completion for underrepresented STEM graduate students during COVID-19. This is a project that was done in conjunction with our colleagues at the Council for Opportunity in Education and the Council of Historically Black Graduate Schools. Now, I'm just going to give you very high level findings, and then we can come back and talk about them as we have time. But let's move on to the surveys, the data sources, and then to the high level results. Next slide, please. So basically, I'm going to summarize results from 3 separate surveys. One is a survey of undergraduate students who were participating in undergraduate pipeline programs, mostly McNair programs, but also from a variety, Ellis Amp, Mellon Mays Fellows, and a variety of other undergraduate research pipeline programs. A survey of current graduate students, as you can see, almost 4,000 of them from 86 different institutions, and then a survey of pipeline program directors. So what did we find? By the way, these surveys were mostly conducted in August, July, August, and September of 2020. So finding number 1, and I think this is really important, that is that among prospective students, the interest and intention to continue into graduate education has not changed, but enrollment in those programs very well may be delayed. And as you look at these findings, it talks about how many, you can see that a proportion, especially of men in undergraduate pipeline programs, said they'd never been more determined to go to graduate school than they were now. But in point of fact, nearly 80% of all the female students, undergraduate students, and 70% of men reported cumulatively that they were either less likely or more uncertain about intentions to immediately pursue graduate education following completion of their undergraduate degrees. This is reflected and amplified by program directors who reported an increasing proportion of students who intended to take a gap year, either because of disruptions in their families, concerns about relocating to new communities and establishing a support network at times of pandemic, or for a variety of other reasons. So we get an increasing proportion of students who are being groomed for graduate school saying there's going to be some delay or is likely to be some delay in their matriculation into graduate programs. Next slide, please. It's also the case that while, again, they remain highly interested in graduate school, there is some indication that their first degree objective may have changed. And this is more so for women than for men. In point of fact, you see that approximately a third of the women participating in undergraduate pipeline programs said that they had changed their decision about which degree to first pursue. Now, what this in point of fact is almost certainly, we didn't ask specifically this question, but these are students who are being groomed for the PhD. And if they have changed their immediate degree objective, it is very likely that they have changed the degree objective to a master's degree or perhaps another kind of clinical professional degree. Again, I want to point out that it is women that you see the greatest change in, and this has real implications, I think, for fields that are still struggling with gender diversity in their programs, to understand that progress in this regard may be challenged unless we develop real strategies for staying in touch with those either who have decided to start with a master's program or have decided to stop out on the way. Next slide, please. When we asked these students what were the major barriers that might prevent them from attending graduate school immediately, there are a few surprises. Unwillingness to take on more student loan debt is a major factor. Some concern over standardized tests not being a good way of displaying their skills, and so on and so forth. I want to spend just a minute talking about the unwillingness to take on more student loan debt, because in point of fact, we found that among these students, many were unduly pessimistic about the opportunities for funding in PhD programs. You know, again, remember during this time period, there was much publicized studies about universities reducing the size of the classes they were admitting, concerns about whether there was going to be sufficient funding to see current students through to completion of the degree and bring in a new cohort. So again, one of the worries is that students may have self-censored themselves because of their worry that in point of fact may not have been a well-founded concern. So worrying about moving, worrying about careers, and I think Craig probably will talk about, and Janet too, will talk about career uncertainty. But these issues are big challenges as students try to think through what's the right next step for me and as appropriate my family. Well, if we move from looking at prospective students to current students, next slide. What you see, of course, we found a lot of other things, but what you see here is that students are strongly committed to completing their degrees. They fully intend to complete their degrees, believe they will complete their degrees, but are quite certain that it's going to take them additional time. This is the only slide I have from our current student survey. Again, I think both Craig and Janet will talk a little bit more about that, but we do know from this study a great deal more about them. Again, we know that the burden of care is disproportionately shared, as is a consequence of pandemic-related job loss. We know that most students did not have their own funding packages disrupted, but of those who did, it was over a much larger percentage were women and students of color. Again, just emphasizing that longstanding inequities and injustice have simply been amplified and made obvious by the pandemic. Well, one last slide before turning it over to Janet. And that is, what kind of advice did we get from undergraduate pipeline program directors who were very much in contact with their students? What kinds of resources did they wish or hope that graduate program directors and graduate faculty could provide? Certainly, connecting students with program alums who can talk about the variety of career opportunities and experiences, the type of educational experience that they had while enrolled in the program was indicated by nearly 60%, 56% of students. Again, in this era of disruption, undergraduate research opportunities and making sure that students had opportunities, perhaps if they had missed the real hands-on experience while doing a lit review or a secondary data analysis, giving them additional experiences and opportunities to really try to imagine themselves, in this case, virtually, as being a part of a campus and a campus community were important. Again, I want to simply foreshadow a conversation that I think is really important and will come up later, and that is the role of helping students, prospective students, as well as current students, understand the variety and diversity of career opportunities for individuals who earn a graduate degree. So with that, I'm going to turn it over to my colleague, Janet Gao, to present some more of the results from our study.
Next slides, please. Thank you, Suzanne, and thank you so much for AEPT for inviting me to this presentation, and also thanks so much for Alexis, your coordination for this webinar. And good afternoon, everyone. My name is Janet Gao. I'm the Research and Program Associate at this Council of Graduate School. So in the next 10 minutes or so, I would like to present some of the highlights from the rapid convening. If we can move to the next slide. So on June this year, in collaboration with Council of Historic Black Graduate Schools and the Council for Opportunity in Education, we hosted a 2-day virtual convening, which is part of the NSF Rapid supported project. So here I would like to thank you, NSF again, for providing grant to support this project. So the purpose of this convening was really to serve as a platform for the graduate education leaders to compare, discuss, and curate some of the emerging evidence-based practice and approaches to mitigate the adverse impacts of COVID-19 pandemic on the URM graduate education pathway, particularly in STEM fields. So there were around 50 participants attended the convening, comprised of graduate deans, McNeil program directors, and other campus stakeholders. We also have some representatives from the different consortiums. We facilitated 4 panel presentations and discussion, each followed by small breakout sessions organized by 4 themes, which were identified based on the quantitative and qualitative data generated from the baseline survey, like Suzanne just covered earlier. So I will, today I will mainly go over the 2 things, continue with our next slides. So the 2 major questions we asked, number 1 is how have caregiving responsibility impact the ability of the students from traditional underserved backgrounds to pursue and continue their graduate study, with specific asking some of the potential opportunity that institutions do to support students with a caregiving responsibility. The second major question we asked is around how does the COVID exacerbated the sense of career uncertainty among current and prospective graduate students. So with specific ask, institution, what kind of action they have to take to address or alleviate some of the concerns among current or prospective graduate students. So at the convening, we took the notes, we summarized a set of concerns and as well as strategy and tactics to implement promising practice and policy that will help students, will help support a diverse, inclusive pipeline into and through the graduate program. So in the next slides, I've outlined those points. So at the convening, participants reported the limited caregiving resources accompanied by the increased mental stress. I'm sure Craig will talk about later. During the COVID-19 have negatively impacted student decision to pursue graduate education. So we heard that historic underrepresented students and female students were especially vulnerable. And second, graduate students who are also essential workers, they have to gain extra hours that may otherwise be used on their study, especially for those whose family member experience job loss. So the stress caused by this factor, accompanied by the lack of on-campus child care, have posed challenges on time management for asynchronous learning experience. We also heard that worries about technology and lab access, the study space, the regular mentorship, and continued funding have led to ongoing stress over the timeline for the degree completion. And another important takeaway is that students wear many hats during the pandemic, and the different roles they played are irreconcilable. So for students, there are new moms, single parents, or parents with multiple children. The challenges surrounding childcare were multiplied. So what can be done and has been done to alleviate the concerns? Let's move on to the next slides. Institutions agreed that they could do or have been doing more to support students with caregiving responsibility. For example, we constantly heard that communication is essential. This include outreach to students who experience challenges, and also creating those office hours, especially for the students in rural areas, so they have a space to connect and engage with school and faculty members. We also heard the importance of foster peer support group, so students can have the opportunity to know other students with similar responsibilities. Another interesting suggestion we learned from the participants is that virtual space could be normalized and intersected with life and home. So many said that simple solution of going virtual won't meet students' needs. So institution can perhaps create a more inviting virtual supporting environment by engaging families and children as part of some virtual spaces. The participant also discussed that when students return back to the campus, institution can consider reopening the child care centers on campus, making Head Start program available to eligible students, as well as exploring some of the weekend and evening options for, particularly for doctoral students, to accommodate their family and work obligations. Moreover, similar to the finding from the rapid baseline survey, continued sustainable funding, especially through the teaching and research assistantship, are critical. And also, last but not least, reducing the structure barrier, for example, preliminary exam, which we used to think of as a prerequisite to success, and can perhaps encourage students who was discouraged during the COVID-19 to pursue the graduate schools. And next slides is on the second thing about career uncertainty and value of the graduate education. So a participant at the convening reported that pandemic, and the notion of career uncertainty have created stress among the current and prospective students. So we heard that academic job market has suffered for years, so the pandemic has worsened that crisis, especially in the STEM field. And also the fact that pandemic halted opportunity necessary for tenure especially for marginalized academics, exacerbated the sense of a career uncertainty among current and prospective graduate students. So in terms of choice of graduate program, prospective students show their interest in the program in the medical arena, which seems to be driven by the pandemic. And many participants also saying that the students selected graduate program that led to broader lens of career options, include professional development opportunity beyond academia. So the last slides, I do want to talk about the approaches to address career concerns and to communicate the value of the graduate educations. So we heard that graduate admissions have been navigating and adjusting the recruitment tactics by a specific or targeted population, for example, first generation, international students. And for the graduate program specifically, they help the student to identify and pursue multiple career pathways, both within and beyond academia, which include perhaps focusing on the professional license, so students can see what their degree lead to which career outcome, and also working with industry partners to support students to work in various industry. So consistently, and we heard that the three words start with C: communication, connection, and community. Many participants have stressed the importance of creating this office hour and spaces that foster frequent communication and checking, which can create a culture of welcoming and belonging. So an effective support mechanism cannot live without faculty members. So institutions have been training faculty so they would be able to provide type of a mentorship that students need to be competitive for the graduate program. Last but not least, we also heard virtual career fairs can ease student anxiety on career prospects, and also participants have encouraged engagement at regional and national consortium level that look for opportunity for best practice and network that student needs. So above are the overarching highlights from the rapid convening regarding how we can support graduate students with various caregiving responsibility and how to address the career concerns, as well as how to communicate the value of graduate education. So now I'm going to turn it over to Craig. Craig, the floor is yours.
All right, thank you. Let me share my screen. And here we go. All right. Well, let me double up on my thanks to AAPT and Alexis for inviting and for doing all the organization for this. So my name is Craig Ogilvie. I serve as Graduate Dean at Montana State University, and this is a great joy for me because professionally I worked for many years as a physics faculty. So, you know, been in this job for 2 years now, and perhaps at some point I'll be able to get back into teaching and research, but it's been pretty much all encompassing at the moment. So I'm going to be talking about some of our work that we, were funded by NSF, so to study the impact of the pandemic on graduate students. And I've titled my talk a little bit more proactively to try to, than we had in our research proposal about what might look like a trauma-informed graduate education. And hopefully that will make sense as the talk proceeds. So again, I have to acknowledge NSF, but I also have to do the standard disclaimer. Everything I'm going to say is our thoughts and not the thoughts of NSF. So we surveyed last summer students from 12 institutions across the country, varying levels of research activity, different locations, different type of demographics. We also, like the CGS survey, did students from all fields, masterates, doctorates, and professional degrees. We got over 4,000 responses. It was somewhere about a 7% response rate. Students were pretty stressed about this time, middle summer of last year. We also interviewed, I have some amazing social science colleagues, and they interviewed students in focus groups. And then we did a follow-up survey this last summer, and that survey, the people who asked to do that survey were those who responded to the first survey and said that they were interested in being followed up on. And we had about 850 results from that second survey. Like Suzanne and Janet, I'm not going to be able to give you the full set of results. I've chosen to highlight the trauma results. So we included in this survey a few standardized instruments on stress and anxiety, but one of the ones that we included was one on post-traumatic stress symptoms. One of our colleagues had expertise in that. So that's about 20 questions. It's a fully validated instrument. And it asks questions about how frequently in the last period of time, a couple of weeks, have you had instances like bad dreams or struggling to fall asleep, and quite interestingly, sort of acting uncharacteristically irritable or aggressive. So that's what I'm going to highlight a bit and then talk about potential solutions. So the percentage of graduate students who scored high enough on this scale that if they were in a clinical setting, they'd be recommended to meet with a therapist to start talking about ways to mitigate some of the stress that they're under. So I want to be very careful. This is not a formal diagnostic of post-traumatic stress disorder. This is just a screening instrument. But the results were that about 30% of our students a year and a bit ago, 15 months ago, scored above that threshold. And this last summer, just a few months ago, when we repeated the survey, it did look like it had gone down a bit. I have some colleagues who are trying to figure out if that's a firm result, but it's sort of still around the sort of the overall 30% rate, which for me as a graduate dean and as a person who's supervised graduate students is a sort of a worrying effect. Let me try to explain this graph. This was a correlation analysis we did. It was a regression model. So I can't sort of say that these factors are causal. All I can claim is they're correlated with post-traumatic stress symptoms. On the horizontal axis is a measure called the standardized estimate. It basically tells you how much a given question or the student's response to that question is correlated with increasing or decreasing their stress symptoms. So the measures on the top are the ones that correlate most strongly or equivalently drive the numerical value of how often they report these post-traumatic stress symptoms. And then on the bottom, you'll see that our negative values, those are the protective aspects that lead to if a student senses support, then their stress symptoms are going to be lower. So I want to give great kudos to the physics faculty members out there in this webinar. I mean, you did an awesome job, right? So the students that reported that their supervisor supported them overall had reported low levels of stress. But similarly to what Suzanne and Janet reported, the factors that tended to increase this post-traumatic stress symptoms were factors about basic needs, worrying about food or childcare, but also those that are worried about, is my timeline going to extend, what sort of career I'm going to have afterwards, but also, disproportionately, if you reported a marginalized identity of either, ethnicity or gender, or a trans identity, then you increased the level of stress that you're under. To sort of further illustrate, this is some of the focus group results. I'll let you sort of read the quotes as I'm talking through them. I think what I'd like you to sort of look at or think through is each of these quotes sort of speak to either the somebody's shutting down. So the classic symptoms of post-traumatic stress is that you either you have difficulty figuring out how you're going to respond to a given situation. You either shut down completely or you overreact. And our bodies are not really geared towards ongoing stress. And so post-traumatic stress disorder is almost one way to have this happen in somebody is ongoing stress. So the first person is, I think, in that category that they're shutting down. The last two quotes are more overreactions. The second quote is somebody who thinks that there's going to be a real disaster. So it perhaps is an overreaction to what's happening. And then the final quote is from somebody who says, look, I'm just really angry. And somehow things that are happening in their life, they're almost, from what I understand from this focus group, they're overreacting those situations and they're sort of angry and upset. So that leads me to the final half of my talk, the second half of my talk, is I did want to try to figure out, because I'm a practitioner, I serve as graduate dean, and I'm trying to help certainly the graduate students at Montana State, but also by venues like this, graduate students at other places. There are lots of ideas about how to perhaps humanize graduate education. And as Suzanne said, that these were perhaps in motion before the pandemic, and the pandemic may be accelerating these. I'd like to introduce you to the CDC framework. I think it's a very interesting framework through which to somehow make decisions about what type of initiatives we might put in place to improve graduate education. And so the CDC guidelines, the website, you'll have the slides afterwards, start off with sort of safety, trust, and transparency, then move on to, as Janet emphasized, the very importance of community and connection. And then at the end, there's an interesting part of this, which is sort of empowerment, agency, and choice, and also taking into account sort of different identities and ethnicities. So my sort of suggestion, I wouldn't be so bold as to request, but my suggestion is that people in this webinar can think about doing perhaps one project in each of these sort of three areas that I've indicated by the red brackets. So instead of feeling like there's being overwhelmed, that there's so much that could be done, I'm going to use the remaining few minutes of my talk to say, look, just choose one project from each of these three areas, and I think that will make a big difference in our students' lives. Okay, so let me take the first area. I'm going to have 3 slides that take one of these red brackets at a time. So the first one is safety and trust. I think everything that I've learned from my colleagues who have got far more expertise than I have is to learn about trauma and PTSS, right? So to learn about how students, and this is on the order of a third of our students, have real difficulty regulating their responses. And so learning about that and understanding that, and in some sense sort of normalizing that, I think is a key first step. I think to really have a sense of safety, graduate students need to know their faculty. I know this is an oft discussed issue about where the boundaries should be between a graduate student and their faculty members. I think everything I'm learning about trauma-informed education is to err on the side of forming a a good personal connection. That can be done with simple things like just occasional group meeting, go out for a walk, or outdoor activities. I live in Montana, so that's relatively easy where we are at the moment. I think also normalizing the fact that there is most university a counseling center that will have screening, normalizing at each start of each semester that students should undertake one of those screening. And as Janet said, I think there's a real critical need for sort of support on the basics. So if students feel like they've got support for their basic needs, I think they're going to be more successful as a graduate student. The community is really important. Everything that I've read about trauma-informed education is to have connection with the peers. That can be the peer mentors for the incoming graduate students. They get the advice of the hidden curriculum about what it's like to be a graduate student. Study groups, if it's the first year students, or writing groups if they're later. Having students work on outreach projects together or social events. The collaboration is a tricky thing because we are all in a research community where we're collaborating, trying to make advances in science, and sometimes that just takes a long amount of time. But I think what we're learning from trauma and having students have some breaks and some time to sort of take care of either themselves or their other care responsibilities is the importance of setting reasonable hours. These two quotes were particularly heartbreaking for me, and there were many others as well. Right? So the idea that somebody feels like they're just a cog, they're part of a machine. There's burnout, high level of stress. I think are important things for us to read and hear and try to make the graduate experience as humanized as possible. So the third area, was a bit of a surprise for me. Suzanne said that that we were, the pandemic accelerated some things that were already in progress. This wasn't so much on my mind before the pandemic, but it's this idea that if students are feeling they're in a situation where they don't have much control, like a pandemic or like other sources of ongoing stress, that it's important for us to think through about what is agency? How can we can structure our graduate degrees such that students have as much agency as possible? I think a critical part of that is the completion of the degree. As Janet said, it's a high source of stress. So putting agency into the students' hands about making as much progress towards their degree and being in charge of planning that and not having the faculty member have the outsized say in that. Likewise, career, if a student feels like they're moving towards a career that's going to provide some agency. And then the final is, students want to really make a difference, right? So I'm sensing across all the graduate deans that I meet with that there's a lot of interest in students leading projects to try to make a difference in their community. And I think we can do what we can do to support that. And the final, on the equity side, again, this is sort of something that Janet and Suzanne brought up, is the idea that it's an opportunity for us to really examine in graduate education and physics graduate education in particular, our systems, and are there differential impacts that we really need to address. And by all means, there's a lot of experts on your campus on how to create a more inclusive and equitable graduate education. So that's what I have. The main takeaways is I think about 30% of our graduate students are reporting post-traumatic stress symptoms. And my suggestion to you all is to think about taking on one project in each of these three areas. And I think that will make a a huge difference in making graduate education more humane. Let me stop sharing. Oh, let me give acknowledgement. This is the team. I really, there's so many people here that have really not only lent their expertise, but also their time and talent to making this project possible. All right, there we go.
Thank you so much. That was a lot, and I really appreciate your suggestion that we take on some of the areas and try to do one project decently. We have some questions already, and feel free to populate the chat or the Q&A. It's a little easier sometimes to get to things. So the first question is, have the findings been published? I saw that Craig flashed a link on the end slide, but have the other findings from Suzanne and Janet's work been published that they presented on? You're muted.
We presented findings at a number of conferences. I think, Janet, I can't remember if some of the findings are available on our website, but we have not submitted for peer-reviewed publication at this point.
We have the white paper. We've also submitted, so our paper is under review. If one of the anonymous reviewers is in the audience, I encourage you to approve it. It's a great paper. Let's get it out.
This will be on YouTube as well, so maybe that anonymous
There we
review
go.
So some other questions. You talked, Janet and Suzanne talked a little bit about sort of spaces for students to, find community and whatnot. One of the questions is, are there examples of spaces for graduate students that are not discipline specific?
So the participants talk about some of the solution actions that general to the STEM, but they did not specify which discipline that would be. But they did mention in terms of, I'm not sure if this is relevant to that question, but they did talk about when graduate admissions try to engage student back to the program, they did design some policy that's specific for the discipline because you have to have a different approaches to social science versus to the hard science. But to your question, we didn't hear anything specific to the discipline in terms of how do you create the spaces. But they did mention one thing about lab access. So I think that's probably in particular to some, hard sciences, try to open the spaces where, on campus where, the student was not able to conduct at home. But, we don't hear too much about discipline specific actions. I hope that helped in some way.
Let me give a +1 to Alana's comment in the chat. I think the graduate unions, and in full disclosure, there's a graduate union here at Montana State, and I'm a huge fan of graduate student unions, so that's going on YouTube as well, I suppose. I think the dual feature of the connections, the empowerment, I think is there's a lot of good that's happening in the movement towards graduate student unions. I know there are particular issues on each campus, so I'm not speaking to that. I'm speaking to the more general, that there's a lot of, I think, a lot of positive aspects about having students organize and make connections across their disciplines.
The one other thing I would add is that not from this survey, but from other work we do, we know that graduate deans are reporting higher than ever participation in cross-disciplinary professional development and career and leadership development offerings. Now, again, remember that our major stakeholders are graduate deans, who by definition are bringing together people across disciplines. But in that context, I know that virtual offerings have been in very, very high demand. And that this virtual format makes it more accessible to more people, including those whose personal lives and schedules might have prohibited them from participating earlier. So I think there's some good news on the horizon for faculty in particular departments. I guess I would just, maybe it's a bias, but I also think it's true statement that graduate schools and graduate deans can often be great resources in helping connect and amplify community.
Well, thanks. And then there's some questions about the survey. So regarding the PTSS quantitative questions and findings, is there a way to differentiate the markers of PTSS from what might be considered normal grad stress, including the impact of amplifying factors?
Yeah, so I would be so happy if we found in our literature somebody who'd given this particular instrument before the pandemic. So I don't know what a baseline is, because we surveyed a few months into the pandemic, or 6 months into the pandemic. So I don't know what the baseline is. I think my colleagues who certainly know much more about this than I do tell me that there's a strong correlation between the anxiety measures that you may be familiar with, right? So some of the questions are very similar. Are you having difficulty getting asleep? Are you not enjoying some of your activities? So I think I've understood that there's a correlation in the literature between the two instruments. We actually also included those anxiety instruments into our survey. We see the same sort of correlation, but they're not the same. So the PTSS has things like, are you overreacting? Are you shutting down? And so I think there are distinct aspects. So they're correlated, but they're certainly not the same. And I think what I've learned is that the lessons that we might take as change agents are also slightly different, right? If somebody's anxious, then we might focus more on sort of mediation and self, but the stress may lead us to more, so the PTSS may lead us to more, what can we do as an institution to reduce, not do any more harm, so to speak, in this area.
Indeed, I think there's a lot of things an institution or even a department or even a research group can do to make things a little better. And another question is, in the survey, you've mentioned undergrads and current graduate students. How are students who were admitted to the grad program but hadn't yet started handled? Did their survey answers differ at all from current graduate students?
I do not think that we would have had any students who were not matriculants in our survey, because it was administered to students who were registered graduate students. So those who may have deferred matriculation would not be included.
Yeah, and similarly, we only surveyed current graduate students. We did see some differences between students that were later in their graduate studies than those that were starting, particularly around the career questions. Those students that were later were much more worried about their career than the ones that were just starting.
Gotcha. And then there's a question about, so Craig's in a different position because he's a physics faculty member and a dean. What do you think, and Janet and Suzanne can also weigh in, what do you think can be done at the departmental level versus where you might want to loop in someone who's at upper level administration?
Yeah, I think the department level, and I have seen that there's one of the participants is one of my colleagues at Montana State. So at the department level, I think normalizing expectations around hours, work expectations, and work-life integration or balance, but also normalizing good mentoring. I think we quite often in physics departments we have how one faculty member mentors their students is quite often not necessarily the direct concern of other members in the department. But I think it really, as Suzanne's mentioned a couple of times, I think the trend was starting to be more of a village mentoring and really to use the committee structures that we have to support students, and utilizing that committee as to somebody who can provide another viewpoint or to help. I think those are important departmental level, right? The graduate dean can help build community and career events, and perhaps encourage things like this, the safety with the mental health screening. But I think the culture of how research is conducted is a departmental level initiative. And my instinct, I don't have proof for this, but my instinct is that the scholarship is going to improve if the environment is humane.
Craig, if I could just jump in on one point that this question raises that comes up over and over again in conversations, our work with program directors, and it goes something like this. Stressed out faculty cause stressed out students, and that you can't really tackle the question of graduate student health and well-being without also recognizing and tackling the question of the kinds of pressure. I suppose you see it most in our tenure track faculty colleagues, but certainly it's across the board, this sort of sense of pressure, unrelenting pressure and being a cog in a machine. So I think, this notion of departmental culture is a really important one, and recognizing how closely our expectations for one another as fellow scientists and faculty members gets amplified and reflected in the lives of our graduate students. So it really is, it's something units and departments need to really spend some time thinking about and working with each other around.
I also would like to add that some information are access specific by department only, because in the convening we did ask how, when we identify students who might have taken stop out in the past year, and how do we engage them back into the graduate pathway? So a lot of the time we can retrieve the information from department regarding which student registered pre-pandemic, but stopped out during the pandemic. So department would have that authority and capability to utilize email, social media, and other network to check in with the student and to help them find the pathway for success, and making sure the message are deliverable while not posing any burden to students. So department play a super important role in this.
Great, thanks. And I think we have time for one more question, which is, are you aware of any data regarding qualifying exams or comps and differential impacts they may have had on marginalized groups?
I'm not.
I know sporadic pieces of data. I'm not sure it's been extensively studied. I think there's a lot of evidence in the literature that high stakes exams or hurdles are all prone to stereotype threat, and the challenge that comes with adding additional cognitive load, that you are really worried that based on your identity that you're in a minority in the field. So I've seen some indications in sporadic data. I know my physics department colleagues here at Montana State have been looking at this in their sample, and they do see some indication, but like many departments, as a single department, it's hard to get statistical, to nail that. So I think there's an indication, and then I'm going to be a little bit heretical as a physicist. I think the indication is strong enough to be able to take action. I don't think we need to wait for absolutely robust statistical evidence on some of these questions in order to take action on it.
I think that's a great way to end. We don't need, the greatest, a million data points to necessarily take action if we have other compelling data. But I'm also a mixed methods researcher and I do qualitative and quantitative stuff. So
Right, there we go.
thank you so much, everyone. Thank you to our speakers, Janet, Suzanne, and Craig. Thank you for the audience for attending. I know this is kind of a difficult topic, especially considering we're at the end of the semester, end of the year, and everyone's really tired from lots of pandemic-y type things. I'm stopping the recording now.